According to the World Health Organization, at the end of 2006, right here in Ohio, there were 8,323 people living with HIV and 7,084 people living with AIDS. These numbers only include known cases where the person was tested and found to be positive. Those numbers have nearly doubled since then. At the end of 2008, there were 15,746 people with HIV and 12,268 people living with AIDS. Among those found to have HIV, 90% of African Americans, 70% of Hispanics, and 60% of Caucasians said that they did not know that they were infected. Most likely, everyone in this room has met someone infected with HIV or AIDS, possibly without knowing it. Today, I'm going to tell you the problem with not being tested for HIV or AIDS, what's currently being done to help people get tested, and I'll show you the benefits of being tested. In 1986, Susan Sontag, noted American author, filmmaker, philosopher, literary theorist, and political activist, said age obliges people to think of sex as having possibly the direst consequences: suicide or murder. While most people know that there's no cure for HIV or AIDS, according to Raymond Smith at the African American Coalition Against AIDS, most people will never get tested. In the interview I conducted on February 18th, Mr. Smith said that a staggering 80% of people tested don't even really know what HIV or AIDS is or how it spreads. HIV infects cells of the immune system, destroying or impairing their function. Infection results in the progressive deterioration of the immune system, leading to immune deficiency. AIDS applies to the most advanced stages of HIV infection, defined by the occurrence of any of more than 20 opportunistic infections or HIV-related cancers. More specifically, HIV primarily infects vital cells in the human immune system, such as helper T cells, macrophages, and dendritic cells. HIV infection leads to low levels of CD4 T cells through the three main mechanisms. Firstly, direct viral killing of infected cells. Secondly, increased rates of apoptosis in infected cells. And thirdly, killing of infected CD4 T cells by CD8 cytotoxic lymphocytes that recognize infected cells. When CD4 T cell numbers decline below a critical level, cell-mediated immunity is lost and the body becomes progressively more susceptible to opportunistic infections. According to the Centers for Disease Control, HIV or AIDS is spread through unprotected sexual intercourse, including vaginal, anal, and oral sex with an infected person, transfusion of contaminated blood, and the sharing of contaminated needles, syringes, or other sharp instruments. HIV or AIDS is also spread between a mother and her infant during pregnancy, childbirth, and through breastfeeding. Knowing your HIV or AIDS status and that of your partners can literally mean the difference between life and death. If you learn that you're HIV positive, you can take the necessary steps before symptoms appear to access treatment, care, and support, thereby potentially prolonging your life for many years. Eventually, most HIV-infected individuals develop AIDS. These individuals mostly die from opportunistic infections or malignancies associated with the progressive failure of the immune system. As stated in the AIDS Resource Center of Ohio pamphlet, Living with HIV/AIDS, without treatment, about 9 out of every 10 persons with HIV will progress to AIDS after 10 to 15 years. Many progress much sooner. Treatment with antiretrovirals increases the life expectancy of people infected with HIV. Even after HIV has progressed to diagnosable AIDS, the average survival time of antiretroviral therapy is estimated to be more than 5 years. Without it, death normally occurs within a year. While there is currently no cure for HIV or AIDS, there is hope. The World Health Organization says that there are promising new treatments, including cryrecombinase and the enzyme triocombinase, both of which are able to remove HIV from an infected cell. These enzymes promise a treatment in which a patient's stem cells are extracted, cured, and re-injected to spread the enzyme throughout the body. The carried enzyme then finds and removes the virus. While this does not yet provide a cure, there are organizations all over the world working to prevent new infections and to help find a cure. Agencies such as the African American Coalition Against AIDS, the Centers for Disease Control, the World Health Organization, and more locally, the AIDS Resource Center of Ohio have helped to spearhead awareness and early treatment of HIV/AIDS. At the African American Coalition Against AIDS, volunteers are paired up with certified HIV/AIDS instructors to canvass targeted residential areas, shopping centers, and commercial strips to distribute educational pamphlets, condoms, female condoms, and testing site information. They alone have distributed over 1 million condoms in New York, Washington, and Baltimore metropolitan areas. The Centers for Disease Control and the World Health Organization work with countries to develop and implement more simplified guidelines for diagnosis and treatment of AIDS and HIV, to decentralize services, and to delegate tasks to less specialized health workers. Specifically, the World Health Organization directs and coordinates authority on international health and takes the lead within the UN system on the global health sector response to HIV/AIDS. The AIDS Resource Center of Ohio provides direct services and support to people living with HIV/AIDS, their family members, partners, and caregivers right here in Ohio, and also works to prevent the spread of HIV/AIDS through public awareness and education. With the combined efforts of the organizations I described and others, we must work together to get rid of HIV/AIDS altogether. According to the World Health Organization, HIV/AIDS kills more than 15,244 per year, 1,270 per month, 293 per week, 41 per day. Something so simple as a blood test could eventually wipe out HIV/AIDS altogether by informing each person what their status is in order to prevent new cases. As mentioned earlier, each and every one of us has probably met and possibly even befriended or dated a person with HIV or AIDS. Have you gotten tested for HIV or AIDS after every sexual encounter? Most people haven't, and they won't. Today I've told you the problem with not being tested for HIV or AIDS, what's currently being done to help people get tested, and I've told you the benefits of being tested. I beg each and every person in this room to take a few minutes from their life now and go get tested. Most facilities even offer free testing on certain days of each month. You have every reason to get tested and no reason not to. Your life or the lives of those you care about may depend on it. While you listen to my speech, 9 children and 5 adults contracted HIV. While I spoke, at least 1 child and 1 adult died of HIV/AIDS, all because someone somewhere didn't get tested.
No ice cream.